White House blog is now asking supporters to report any, quote, fishy information they see primarily on the internet. The White House encouraging those to send an email to fishy@whitehouse.gov. And there are critics certainly of this program, and one of them is with me now, Congressman Mike Pence out of Indiana, a Republican and chairman of the Republican Conference Committee. Welcome back, sir, and good morning to you in Washington. You've got issues with this.
Thank you, Bill.
Tell us why.
Well, I think the American people know that we have a great tradition of respecting the free speech rights of Americans. That's enshrined in our law and in our traditions. And I would hope that before the end of the day today, the White House would clarify this aspect of the website that is designed to collect, I think, disinformation, that's not about collecting information on Americans that are expressing opposition to a government takeover of health care.
Let me get back to that point here. Macon Phillips apparently is director of new media at the White House. He's part of this process. He says there are scary chain emails that are going around and videotapes that are on the internet spreading disinformation. If you were working at the White House and you saw disinformation, and you know how critical this health care reform is, not just to the White House, but the entire Democratic Party, why not fight that information?
Well, look, again, I hope the White House makes it very clear they're not collecting information on Americans that are expressing their opposition to a government takeover of health care. But let me say, you know, I'm also troubled about what's being characterized as disinformation. You know, the President gave a speech the other day, Bill, in which he said nobody's talking about a government takeover of health care, and yet, you know, we saw video of Barney Frank of Massachusetts saying he thought a government option was the best way to get to single payer or a government takeover of health care. The President himself back in 2003 in video that's on the net openly advocated a single-payer system. So, you know, at my town hall meeting in Greensburg, Indiana yesterday, at my town hall meeting in Muncie, Indiana on Tuesday, I didn't sense there's a lot of disinformation out there. I got the sense that an awful lot of Americans, an awful lot of Hoosiers are very aware of this government takeover of health care, paid for with $800 billion in higher taxes. They know it's going to cause millions of people to lose their health insurance and really put us on a pathway toward single-payer socialized medicine.
Where was your town hall meeting in Indiana? What town?
Yeah, well, we've had two so far this week. I popped back out here to Washington this morning, but we were in Muncie on Tuesday. We had, by some estimates, 250 people, about over 100 people in Greensburg, Indiana yesterday.
Okay. You know what, normally when you get an August recess like this, how many people show up for your town hall meetings? I'm not a big draw, Bill. In typical years, you know, we usually get 20 or 30 people. 20 or 30 people. I mean, that was about our guess, 2 or 3 dozen people. I mean, it's remarkable the turnout you're seeing, and not just you, but everybody, be it Republican or Democrat.
Yeah, it is remarkable.
Get back to your original point, though. You hope the White House clarifies this later today. What would suffice for you?
Well, look, we have laws on the books that prohibit any agency of the federal government from collecting information on Americans in the exercise of their freedom of speech. I would hope that this element of the website was either taken down or they made it clear that this was not an effort to collect information that is being disseminated by Americans either verbally or in print on the internet. But look, I'm telling you, the record crowds at my town hall meetings, Bill, people are not uninformed, they are informed. They understand that during the worst economy in 25 years, this administration, running up record deficits and debt, is about to launch a $1.6 trillion government takeover of health care, pay for it with $800 billion in higher taxes, and a whole lot of Hoosiers that I'm talking to back home aren't having any of it.
I got you. Mike Pence, thanks for coming in. By the way, Linda Douglas, Communications Office of Health Care Reform of the White House, says we may indeed post fact checks from time to time to be sure Americans know the truth about health insurance reform. On the Democratic side, they're saying it's just smart policy. I understand your point as well, and we'll see whether or not there's further clarification at the briefing this afternoon at the White House. Mike Pence, by the way, congratulations on getting 250 people up from the 20 or 30 that you're normally used to.
Thanks, Bill.
I think that is typical. Now is an aberration. Mike Pence, thanks. Megan?